Let's cross to Canberra now and get the latest from the Deputy Chief Medical Officer, Nick Coatsworth. Thanks for joining us again, Nick. Firstly, straight up, are we opening up the country now as quickly as the medical advice would allow, or are we deliberately going at a slower pace?
Chris, we are opening up the country as quickly as the medical advice will allow. It's precisely that, and we have, as the Australian Health Protection Principal Committee, all the chief health officers of the country agreed that this has to be a safe and a cautious approach. The reason it has to be safe and cautious is as we increase mobility, we increase the contact between individuals, we increase the number of contacts that we have over a given time period. It is fertile ground for the virus to spread. I completely acknowledge that the cases are incredibly low at the moment. These are the conditions, the right conditions to start lifting restrictions, but we need to do it in a way that we can then plan the next stage, step 2 and step 3, and we'll reevaluate at the 3-week mark, which is, as National Cabinet indicated today.
Yeah, now we all understand that process, and if you're telling us this is as fast as the medical advice would allow at this stage, that is the plan that's been detailed, we can all accept that. But then the reality is that not every state is then going as fast as the medical advice would allow, because not every state is actually implementing this plan as quickly as other states.
Well, that's exactly right, Chris. There's no problem with that, in fact, because different states reach different points in control of their epidemic at different times. I mean, if you look at the Northern Territory, it would be nonsensical of them to say that they need 10 people in a gathering outside because they've got no community cases at all. When you look at New South Wales and Victoria, they are undergoing their testing blitzes at the moment, 8,000 a day in New South Wales and 127,000 in 2 weeks for Victoria. And now those results do take a few days to come in. And I think the First Ministers of both those jurisdictions have been very clear that they want to see what those results are. But the early results are encouraging. Just a handful of cases where they can't trace the contacts in or where they got it, the patients got it from in Victoria alone out of 127,000 tests. So both those jurisdictions, Chris, are doing exactly what the health advice has been, which is creating the conditions, the right conditions for them to move to step 1 of lifting restrictions.
In a way, it seems to me that Victoria and New South Wales at the moment are experiencing a test run for what should be the future of the whole country. That is, they've got very low infection rates across the state, but they're both each dealing with outbreaks, one at Newmarch House and the other at Cedar Meats. And this, of course, is what we're going to need to do in the future, clamp down quickly, isolate and get rid of outbreaks. Are you happy with the way each of these outbreaks has been handled, because they do seem to have gone on longer, infected more people? In the case of Newmarch House, killed more people than anybody would have expected.
Well, the virus does that, Chris, and as we've heard time and time again, the virus in many ways sets its own timetable. The control measures in both outbreaks were instituted quickly, both public health units, although it would be up to them to give the detail. But if the question is, are we at Commonwealth level happy, then the answer is absolutely. The Victorian and New South Wales health departments, as the Tasmanians did with the Northwest Regional outbreak, have brought those under control quickly and in a way that has enabled the cluster to be very isolated geographically and not spread through the community. We've got to remember that we're not immune to this virus, and whilst that remains the case before a vaccine, any cluster it's like a spot fire in January of this year, Chris. It could get out of control very quickly, but what we've seen so far is that public health units are able to get control in a way that's stopping it from spreading.
Yeah, that's very interesting, and as you say, encouraging, because that needs to be what we do in the future. I just want to get your thoughts on this paper released through the Doherty Institute today, a scientific paper looking at the infection spread of COVID-19 in Australia, the early analysis. And the critical point there to me is that it says we estimate the effective reproduction number was likely below 1 in each Australian state since mid-March. Now, we brought in, we're showing this graph now that demonstrates this. We brought in the most extreme lockdown measures just after that, from March the 22nd. Now, I don't criticise any governments for doing that. Of course, we didn't know how well we were doing. They were looking at public responses and what was happening overseas, and we really wanted to get on top of it. Obviously, we have. But does this information, does this analysis help you at all when you think about the low level of risk in taking off some of those extreme lockdown measures now?
Well, I can certainly see how, looking at those graphs, Chris, one might infer that we could have gone without the lockdowns because the basic reproductive number was less than 1. But let me explain why that was the case. It was because the bulk of the cases were imported cases, and that the virus hadn't yet had an opportunity to take hold, thankfully, in the Australian community. What I would put to you and your viewers is that if we hadn't had those restrictions, those lockdown measures, then the basic reproductive number would have been above 1 and the cases would have started to rise. The reason Australia was so different to the rest of the world, and we're in such a good position, apart from the fact that Australians have followed our guidance to a T, is that we didn't have large numbers of cases in the community by the time we started implementing the lockdowns. That is in contradistinction to just about every other country that's had severe outbreaks. They had an undiagnosed community transmission that was going on for many weeks prior to them taking any action.
Yeah, just two questions to finish up, Nick. I really appreciate your time. Firstly, schools. Are you disappointed that we haven't seen more children at school, given the consistent medical advice that we've had from yourself, Brendan Murphy, Paul Kelly and others?
Oh, no, I'm not disappointed at all. I don't think we're alone, Chris. There were at least 186 other countries around the world that took their children out of the classroom. So it was a very rational thing to do at the start of the pandemic, when we did not have as much evidence about how COVID-19 was behaving in the young population. We have that evidence now, and children are less affected. They tend to transmit the virus less, and the most important thing from a school's perspective is to keep their adults safe, their most precious resource, the teachers, by ensuring that teachers themselves keep their physical distance from each other, and that kids and teachers don't go to school when sick. That is 100% not permissible now in the age of COVID-19. But we have created the conditions where every jurisdiction, with no exception, their chief health officers agree that schools are safe places.
Yeah, now also, just to pick up on your point, which I think is entirely accurate and worthwhile, and that is that Australians in the main have been very cooperative with all these measures that we've put in place. So they can claim a lot of the credit, along with yourself, your officers and the politicians, for getting this done. Given all that, are you a bit surprised that we're not getting more buy-in to the app now? I know initially the take-up was better than expected, but there seems to be a lot of resistance now. Do you need to keep pushing with that app to get it to closer to 10 million rather than, I think, just over 5 million we have now?
Well, look, 5.3 million's it's the highest downloaded app in the shortest period of time ever. So we've broken records already. But the answer is yes. We need to keep pushing and making the case to Australians for the app, keeping in mind that there will still be contact tracing done by our disease detectives. But the more mobility we have, the more people we'll be in contact with, and the less we'll remember. So we need to take advantage of every technology available to us, including the COVID Safe app, to make that contact tracing process as easy as possible for those disease detectives. And it is a critical element, contact tracing, and so we need to use everything we can to support it. So I'd encourage everyone to download the app.
Just download it, and it all helps. All these tools help. Thanks so much for joining us, Nick. I really appreciate your time.
Thanks, Chris.